Hello, everyone. Welcome back to another episode of the AI Healthcare Podcast. I'm your host, Dylan Reed, and today we are joined with my friend, Dr. Manthan Mehta, who's a physician. He is skilled in digital therapeutics, medical affairs, clinical research, and strategic planning. He's also passionate about leveraging technology to improve patient outcomes and enhance healthcare delivery. Thank you so much for your time today, Dr. Mehta.
Thank you so much, Dylan. Very happy to be here, in conversation with you.
And we're glad you're here. And what made you decide to enter the medical profession and you embracing AI?
Right. So it's quite interesting, right? And I think very early on as a kid, I always wanted to be a doctor, and it stems from two things. Back in the day, traditional career paths for kids who would top in school and do well and get good grades would either be a doctor or an engineer, or be a chartered accountant or a lawyer. So typically you had only four choices. You couldn't be an influencer, you couldn't host a podcast, and all those things were not considered. So that's the reality of the situation, where most people, your teachers and everybody, tries to groom you, into either one of these four professions. And I loved solving puzzles, as a kid. And something struck me, right, I think in my mid secondary school, etc., where was taking part in some science contests and solving puzzles, etc. And one of my teachers told me, the biggest or the most complex puzzle is the human body. And would you like to solve it? And, would you want to be a doctor to solve it? And I said, yeah, why not? Uh, so that's how I think it all started. And when I entered medicine, when I entered the profession, I realized that healthcare is not just about curing illnesses, right? I mean, early on, you think a lot that, I'm going to be a doctor, I'm going to solve for the whole world, I'm going to make the whole world healthy. And you enter with that mindset, but you realize that, it's more about improving the quality of life. It's more about relieving people of that sickness. And it's that space where you marry science with empathy, and that's where I was drawn to.
Mhm.
I think the second part was, you asked me about my inclination towards AI as well, and that's again like a natural progression, with time and the way things are moving with healthcare innovation. And once I understood that, medicine is data rich, right? It's filled with patterns, it's filled with histories, there are variations. And that's when now today you start to see how AI will fit into the picture, right? So if I go back to my puzzle example, it's like I was solving puzzles with my hand, and now suddenly you have an algorithm, that can help you decode the most intricate ones, the most complex ones. So where you take data, you turn it into actionable insights that clinicians can use, to make better, faster decisions, solve all those problems that are there in healthcare. And that's where I think I took this path towards AI.
And so it sounds like you have, or growing up, you had a natural skill towards the medical profession just overall.
Right.
And and specifically kind of on the role of digital therapeutics and its role in chronic diseases in India. So just to kind of give the audience an overview of the country of India, India has 28 states and 8 union territories. And then within those states and territories there are around, 100 more languages spoken in India, and then in addition to the 22 recognized languages. So my question is how do you manage kind of the digital therapeutics and its role in chronic diseases when treating the greater population in India, just given those different either language barriers or cultural barriers?
Absolutely, it's a great question, and uh, just like you explained, the geography of India, which is very complex and very diverse, and so is the healthcare system in India. And it's also riddled. We are very rich in culture, heritage, etc., but it also feeds into our healthcare system. So every patient behavior is very different depending on the culture they belong, the language they speak, the region they hail from. And very rightly said, language is a barrier for most people to solve these things. But if you see the way the evolution of healthcare has happened in India from an epidemiology perspective as well, right? There was a time where we were battling a lot of infectious diseases. We still do. We are trying very hard to get rid of tuberculosis. We got rid of leprosy. we're trying hard to get rid of malaria and all those things as well. And suddenly over the past decade, if you see, we've had this explosion of non-communicable diseases. Diabetes, we are said to be the diabetes capital of the world. Heart disease, is again higher than the average in the world, and is also earlier. And that's where managing chronic care is very difficult. If you look at it, patients, really, you can't leave it just on patients, right? I mean, you have to make this disease management more proactive, more personalized, and more accessible. And patients need more than prescriptions. They need a support system, and something that can help them adhere to these changes, can make them feel a part of navigating this complex maze of healthcare. And that's where digital can help, right? Because you cannot provide adequate support just in the clinic. You cannot just rely on prescriptions for people to change their health behavior and change this pattern. Because if you see over time, if they don't take the right steps early on, it's going to burden the already overburdened healthcare system in India, because everybody will land up with complications. To give you an example, one complication of diabetes is gangrene, where
Mhm.
people have to get their limbs amputated, they lose their toes, they lose their legs, etc. And we again rank one of the highest number of amputees in the world, and 80-90% of it is because of diabetes. And so people don't do it early, and that's what burdens the healthcare system, burdens quality of life. That's where we try to bridge this digitally. The challenge comes in these language issues, etc. So when you productize something like digital therapeutics, you will want to provide support in multiple languages. You would probably want the coaching support, because we are still a country which relies a lot on the human touch, the human element, and those human bonding. So they will not rely solely on an app or a machine to do things. And so you'll have to embed all of it, where you meet technology, you meet medicine, and you meet the human care. So typically, a lot of digital therapeutics companies do is they have human coaches, and all of those coaches belong to varied regions in the country. So they understand, when they're talking to a patient, they understand where they come from, what do they eat, what their day looks like, and they advise them accordingly. And that's where they feel more involved into the system. And while it's great to have digital therapeutics, but these challenges are definitely there until you don't navigate it and don't blend it. You can't have just AI running it in India, at least. So that's happening. There are government initiatives to now bring in the language models. Pashini is one of them, which brings out almost 22 Indian languages now. So that is now coming up, and as soon as we are able to bridge that language and regional barrier, I think adoption will be quite high.
So it sounds like, based on kind of what you were explaining, it's, the overall patient physician relationship is very similar in the US, where you go see a doctor, you tell them what's wrong, they give you a prescription, they give you a treatment plan, and then there's like no follow up. Is that am I getting the patient physician relationship right in India too as well?
Quite similar. Though access to physicians is a little better than the US system, but for most chronic disease, it's similar, because you see the cycle for follow ups are quite long, and at both ends, you even see patients, a lot of patients dropping off, at follow up, because these are asymptomatic diseases at times, so they don't do that. So, uh, moreover, I think overall, the patient physician bond, if you see globally, it's more or less similar in most parts of the world. The reasons and the expectations may vary, right? So what somebody in the US may expect versus what they expect in India may vary a lot, right? For example, in some cultures in India, until a long time, it was very patriarchal for physicians, right? That whatever the doctor says is right.
Mhm.
And so that democratization took a while. Now it's too democratized, right? People look up on information. They've even probably asked AI, or asked Google, and asked various sources, and then they come to doctors. So the expectations of patients are changing a little bit, but overall, I believe it's more or less similar when it comes to a doctor patient bond across the world.
Awesome. And on the note of chronic diseases, you mentioned that it's possible to lower blood pressure without medication, but what do you see as like a potential complication for the patient to adopt to that specific health plan? I'm very curious about that
Yeah.
because I've never heard something like that
Eh,
before.
yeah, yeah. So when we say that, it's mostly to do with giving people a trial of lifestyle changes. Yeah, and there's a lot of advocacy across the world, if you see, where patients now do not want to start certain medications for hypertension, for example, you said, because they believe they're going to be lifelong, so they want to do a trial of things. uh, you know it, the challenge isn't knowing what to do, for patients as well, it's about doing it consistently, right? And like I told you, patients are very aware now and there's overwhelming information. So it's about adopting to these long-term lifestyle changes, and that often is very burdensome for the patient, right? And that's why a lot of people ask for quick fixes, like let me just pop a pill and control my blood pressure or control my blood sugar or any other parameter, and not take that effort of climbing it, right? Because most patients struggle with motivation, they struggle with sustainability, and also the sheer unpredictability of their disease, right? So, for example, you had one stressful week at work, and your blood pressure is going to go, up the roof again. So, they're trying to navigate these things, and when you actually want to do this, right, you want to provide them constant reminders, you want to give them support, you want to give them encouragement, and the most important thing, like you said, to adopt to a health plan is that the patient has to want that change, right? They want to do it. And these things are done through behavioral science principles, where you actually utilize certain behavioral therapies, where you give them small manageable steps to start. They need to see certain results, right? They need to see some quick wins early on, and they need to then stay motivated on it. So it's about designing those health plans in a way which feel approachable, which keep patients engaged. And that's where you these digital elements and these support systems will help. And that adoption takes a while, right? Because of various barriers in terms of the regional things, patient literacy, and the motivation to change. Along with that, having the patience to not rely on a quick fix. So adoption happens when you create that engaging kind of healthcare plans, where they are chasing this goal that, okay, I don't want to start a medication so soon, and so I have to work for it. I need to bring that change, but I need support. And that's where these therapies, digital therapies, can help people.
And you mentioned it earlier, but could you provide an overview of the healthcare system in India?
Absolutely. So it's a dichotomy in many ways, right? So of course, complexity, diverse in all parts, and the dichotomy exists that there are world class hospitals as well. There's facilities, there are hubs of medical tourism within India, where many people across the globe come for medical tourism here. And at the other end, there is a vast rural network which is struggling for access to even basic healthcare facilities, access to specialties, access to a lot of infrastructural barriers. So we are trying to navigate both those elements. Now,
Mhm.
it's a complex system, and at the same time, it's deeply fragmented, right? There is no uniform source of truth that comes, in terms of healthcare data that you're looking at, right? Because everything is quite fragmented. There's a huge mission going on to digitize everything within healthcare in India, but it's quite fragmented for people. And at the same time, there's the burden on healthcare system. The doctor patient ratio is quite skewed. uh, Public healthcare system is very affordable. There are now schemes like Ayushman Bharat, etc., which provide free medical care up to a good amount, here. But again, because it's too affordable, it also gets overburdened very quickly because of the sheer size of the population and the healthcare infrastructure ratio. At the other end, access is very easy in private hospitals and other centers, but it comes at a cost. So that is one dichotomy. The other one is also about mostly being an out of pay market, right? So most patients are paying out of their pocket, either individually or they are paying for private insurance. Government insurance has now started up, but the penetration is still going to take a while. And of course, like I said, because the public healthcare system is overburdened, a lot of people want to move to those parts. So out of pay, and again, these two elements exist of private insurance, of public health insurance that comes with people. And it's also the system which is also struggling on both ends, like I told you earlier. Like, one is on the whole infectious disease element, at the same time on non-communicable diseases. So as a population, India is a young population with predominantly a workforce driven population. If you look at the population pyramid, and people now focus on productive years, and we are seeing very very early onset of most chronic diseases in India. So navigating that, having policies around that in that system makes it quite challenging, where to put focus on. So to give you an example, when we got a reduction in HIV and AIDS cases across India, the government took a stand after a couple of years that we shift this investment into the Indian cancer grade, or and then NCD commission. So earlier there used to be national programs for each disease separately. They clubbed it to provide focus on cardiac diseases, on diabetes, on cancer now as well. uh, and so that focus and policy changes also need to keep happening. So it's a complex maze that people are navigating, but hopefully things will fall in order soon.
And on that note, where do you see the most opportunity in the Indian healthcare system for AI to make a positive impact?
I see the biggest opportunity, in considering India. I think it's about scaling, right? Scaling primary care and the chronic disease management that is coming up. So India is dealing with this whole tidal wave, like I said, and it isn't equipped right now. The current system is quite burdened to handle this volume of patients which need ongoing care. So digital health and AI, I think, can help significantly here, and can also help significantly to drive access, right? Using telemedicine, using mobile health apps, AI driven diagnostics. I think AI driven diagnostics and screening is the biggest thing to bridge that healthcare gap between rural India and urban India, with creating that access. So that is very key. Two, because like I said, we have a lot of patients with complications of chronic diseases coming in later. At that point, I think predictive analytics, so AI prediction at that point, and then personalized care and plans in that direction. Again, to navigate the regional barriers as well within it, but create a system at that front as well. So scale up the primary care, access, screening, to identify diseases early, and not just limited to chronic or non-communicable diseases. So in fact, there are good organizations now working on it to do it for tuberculosis, and detect it quite early to reduce the burden. So those kind of things where you are able to predict early, because the sheer volume of data that comes in India is huge. Right? You just need to collect all that fragmented data and clean it and use it in the right way, where you can then scale primary care, create access, create models, a lot of scope for healthcare innovation as well, uh, and affordable healthcare. So if you develop a lot of technologies, people have developed wonderful screening tools, for anemia in rural areas, for maternal health, for early neonatal issues. So a lot of innovation is happening, but the fragmented system doesn't allow sometimes to do things at scale. But that's where the biggest opportunity lies, to really unify this and use things at scale.
And Dr. Mehta, how big is the population in India?
We are 1.4 billion people.
One, and how is that? How is the population distributed from a medical perspective in the country? Is it more like, is the majority of the population in like Mumbai, New Delhi, like, or is it really evenly distributed? I just want to get a better understanding from like a healthcare perspective.
Sure. So, see, the cities that you mentioned are, of course, the most populous, right? But the distribution of care, if you still see, India is still one third urban, two-third rural, from a broad perspective, right? Like just ballpark figures. And so, the need gap always arises for the rural setups, particularly where access is a challenge, and that's where all these scale-up things become a big thing. For urban cities, while it caters to a different set of population, and both those systems are well developed. So you have great public health infrastructure in all of these cities, and you have world class private facilities as well. So caters to all the segments of the society. the vast population of India in general is in tier 2, tier 3 cities. While of course for the world, the big metros like Mumbai, Delhi, Bangalore, Chennai, etc., look like really populated and really big. They are that way, but the large chunk of India is still semi-urban and rural, which is where healthcare needs have to focus on that population. So every policy also that comes with that in mind, to look at that two-third of the population first, and then look at this one-third here where systems are already in place.
Hmm. And so specifically when it comes to insurance, it sounds like in India that it's a mixture. So you have your public insurance, but then you also have private insurance too as well.
Yes. So it's a mix. Public health is offered to certain segments of the society. Some are based on their financial status. Some are based just for everyone, right, as a population. Private healthcare is the penetration is again low. It's more urban. There's also a lot of corporate insurance where employers are paying for their employees, and that is what is driving penetration today, where they are paying for their employees, and then some of them pay for their parents or other family members, or they can add and pay a bit from their pocket to cover them as well. So that is what has driven a bit of insurance penetration. Very good regulations and policies when it comes to insurance. The insurance regulator of India is very stringent, very good in terms of drafting the right policies for people. But at the same time, a lot of private insurance, a lot of allied facilities may not always be covered, right? A lot of them are based on in admission care. A lot of them don't have OPD services being covered. A lot of them don't have mental health being covered. A lot of them don't have maternal health being covered. So the all inclusive policies then come at a higher premium, etc. And the public policies are given to majority of the population, few based on their income, few based on the schemes that the government runs for various things. So largely the population, if you see, should be public health insured in some way or the other. But again, awareness about it is lacking in a lot of people, that the government has actually provided us with so much. Private, the penetration is still much lower because of premium costs, etc.
So the insurance regulator in India, does that also regulate um, like reimbursements and like what physicians, what type of insurance they must take or they don't have to take, or or is that more of a state and union territory type
So
of policy?
right. So health is a state subject by the Constitution of India. So that is not technically driven by the insurers. They mostly drive on the players that come in, the policies, the way they are devised, and being more consumer centric, being more patient centric in that approach, and seeing that it's fair play for everyone. So that's what they drive. Unlike the US system, where it typically starts with knowing whether you have insurance, and then a lot of conversations are driven that way, and then there's a multi-stakeholder engagement. That's not how it generally works here. So it's more or less wherein patients have, they have an insurance policy, they inform about it, and there's no change in terms of the doctor trying to change their therapy based on the insurers, the provider or the data given there. There's no regulation around that. So there are of course capping of policies and pricing and all that is there to maintain things, and so that there's no overpricing by hospitals or misuse by anybody. But they don't have a say in that if it's a different provider, then the care will differ or the type of hospital will differ, etc. So at a broad level, there are segments that they have divided and done things to reimburse people, but most reimbursement lies either on the patient themselves, or for public policies it lies on the government to get it reimbursed from them. So uh, mostly the physicians are not very much involved in this scheme of things.
And how do you see physicians contributing though to the greater AI health conversation that we're having globally?
That's great. I think I just read day before, somebody on LinkedIn had written about not having physicians or clinicians in health tech. If you don't have them on your founding team, or if you don't have them in your core team, how it is. And I had given an analogy there of it's like having a racing car. But you've never driven it, so you've made the best one, but you've never driven it. And that's what happens when you don't have a physician, right? So you don't know the curves, you don't know the turns, you don't know how to navigate it. You've built the best technology. So physicians, I think, play the biggest role when it comes to the AI healthcare conversation, because they act as both, right? They are the gatekeepers as well as they are the advocates of AI in healthcare. Because at the end of the day, AI is a tool for them, right? And it's the physician who's going to interpret those insights, who's going to apply them in patient care. I also see this whole debate happening everywhere where physicians keep talking about, AI versus doctor, and a lot of research gets published, right? That they cracked the medical license exams. They showed significantly better, AI showed significantly better empathy towards patients in their conversations. Physicians using conversational AI get better patient retention, and all those elements come in, which sometimes creates a bit of insecurity in a lot of minds, where they feel that, is it AI with doctor, AI versus doctor? So I think that conversation needs to move to that, this is just there to amplify, to augment, and not to compete. Because eventually physicians are going to bring that human touch, right? They understand the patient's history, they understand context in a very broad way, rather than the way AI understands context, right? And nuances which AI can't replicate. But the problem is that physicians are not involved early on, by
Mhm.
both parties. Physicians also themselves don't get involved many a times early on, because you see healthcare adoption is quite low of all these technologies, so they don't get involved early on. And that's where the difference will happen. If they are involved in the design right from those stages, early stages, to the deployment stage, then all those insights into that clinical workflow, into patient care, will help make AI more practical, and at the same time it will help AI become more ethical. Because you have to make it work, right? And so within healthcare, I think physician is, while we say patient is the center of everything, but for the healthcare system, physician is that key stakeholder which actually has to implement things, and this has to be done keeping them in the loop. So the earlier they are on the loop, the earlier they voluntarily get involved, and don't see technology as a competition or as something futuristic, but believe that we need to do this to make healthcare more efficient, because it's making their lives much better than it's making patient lives better. Because you are now able to focus on all the complexities, on the nuances, and all those elements, because somebody is doing all the grunt work for you. So if you
Mm.
help technology and technology developers to enter into that insight of the workflow that you do, and how it impacts the patient in the right way, you can help them develop something which is actually useful. So I think physicians play a very key role, and they should be involved very early on.
Great. And then my last question is, what do elected officials need to understand when constructing policies that directly impact the implementation of AI in healthcare?
I think first is that they need to understand that AI isn't a magic bullet. Yeah,
Mm.
sometimes we see all lot of these people or policymakers uh, clinging on so much to it, like using it so often, thinking that it's going to solve healthcare's all systemic issues overnight. So that's not going to happen. But I think what it can do is AI can enhance your care delivery, right? It can optimize resources, it can make healthcare more accessible. So but for that to happen, I think policymakers must focus on infrastructure. And when we talk of infrastructure in this part, it's one on data availability, right? Then the whole element of interoperability. And we coming from a fragmented healthcare system, I can tell you how much of a challenge interoperability is. And ensuring that these systems are transparent, they are ethical, and they are free from bias. So having said that, I think that takes us to the second bit, which is regulation, right? That's what they also need to look at, that regulation is essential. But I will also want to be very candid here and say that flexibility is equally important, because healthcare innovation is moving at a pace which is unimaginable. And if you have overly rigid policies, that's going to stifle that innovation. So we need frameworks, and these frameworks is what all these policymakers and officials need to develop and work on with all the stakeholders, and encourage that there is responsible AI development, but without creating barriers for entry to startups and innovators in this space. Because sometimes if you see a lot of people give up when it comes to creating healthcare startups or innovations, because they see that low adoption, or they see a lot of barrier from policymakers and making things so regulated. We need it, we need all of those regulations in place. But it shouldn't serve as a barrier or detrimental that nobody wants to innovate in the AI space, healthcare space. They all want to now then innovate and create more consumer tech and all or fintech and those places which they feel they can make better use of it, or productize it a little better. So that's one. And I think the last one I would say, and also specifically from an Indian context, would be about digital equity, because we know, right, we generally joke about it when we talk about healthcare. AI is the garbage in garbage out philosophy, right? So it's about how much you put into AI. It's only as good as the data it's trained on. And if we leave out the rural, the underrepresented populations, we risk creating solutions that will work only for a fraction of the country. We are creating something for only the elites. We are creating only something for urban and metropolitan parts of the country, which is not fair. From an AI perspective, I think bias at all ends should not exist. So that equity is there, and there should be policy which prioritizes digital literacy as well. Like you talk about literacy in general. If you have policies which also prioritize digital literacy, adoption
Mhm.
of all these things will be really quick. They need to also help in providing access to healthcare technology, and then have that broader push. We have the universal healthcare coverage policies in India, which talk about equity, accessibility, affordability, quality, and all those elements. So I think these are all the areas which all these policymakers should keep focusing on, with keeping AI in the center, and then keeping reaching it to the last mile. I think the last mile philosophy for AI is when you will develop the right one, and I think it's only the policymakers who can do that, because you know uh, innovators are going to innovate what they find really novel. What is a
Mhm.
problem statement they're going to solve? They will want to productize it, commercialize it, and they have to give it back to the investors and other stakeholders as well. So they are going to think from that perspective. I think the only people who are going to think from the complete last mile perspective, end to end, are policymakers. So I think they play a key role in doing that and driving AI being accessible to all.
And uh, Dr. Mehta, where can people find more about you?
You can reach out to me on LinkedIn, and I think that's easier to connect with me, or you can email me. It's my name at gmail.com. So you can do that as well.
Awesome. And be sure to subscribe to the AI Healthcare Podcast YouTube channel, and also listen to the audio version of this interview on Spotify and Apple Podcast. Dr. Mehta, thank you so much for your time today.
Thank you so much, Dylan. It's a pleasure talking to you, and thank you, everyone, whoever's going to be listening to this. Thank you.
We're glad you made time for us. And this is Dylan Reed